Hello everyone, this is Dr. Simran and welcome back to my YouTube channel. Hope you are doing great. In the previous video, I discussed about the major resources that are required to pass the AMC MCQ exam. The next few videos will be a different series about each subject separately. Today, I'll be discussing about psychiatry, like why is it important, what are the major resources, and what are the important topics, what important points you should focus on while preparing this subject. So let's begin. The reason I'm making first video on this subject is specifically because it is the first subject that I started with after doing my handbook. Also, this is the subject that we don't study much during our undergraduate life, and it is very important for AMC MCQ exam. So it's better to start with this subject in order to have a good concept on different topics. I'll be mentioning what are the important topics for psychiatry, and I will list down the important ones at the end of this video. So don't worry about it. The next thing is the resources. What are the resources that help me to study psychiatry? Okay, so first is the John Murtagh. As I mentioned in the previous video, it is the main reference book for different subjects. John Murtagh has different topics related to psychiatry under the heading of mental health, but some topics are scattered as well. So you need to read those topics thoroughly. But along with the JM, I used Kaplan Step 2 CK for this purpose, and I found it really helpful because Kaplan Step 2 CK has a very good summarized version of psychiatry. Like the topics, the chapters are very short and very concise and very helpful. So I will suggest you guys as well to study Kaplan Step 2 CK along with the JM because the topics are very well explained in Kaplan Step 2 CK. Along with these two books, I solved the Q banks like the Amadex, which is the main Q bank for AMC, and UWorld also for psychiatry. So it's very important for you to solve these two Q banks because UWorld also has very good like case-based scenarios, and the explanations are very good also because there are some topics that you will not find in the books, rather you will find those topics in the Q bank. So it's better for you to study Q banks thoroughly as well and read the explanations thoroughly. And like you must know why are you ruling out this option, why this option is incorrect, and what will be the management if the scenario was different. So you must know each and everything related to that particular MCQ. Then what are the important topics that you need to focus on while preparing this subject? Starting with the defense mechanisms. Defense mechanisms are not much better explained in Kaplan Step 2 CK. You will find some few questions related to these defense mechanisms in the Q banks as well, but I will like attach a link for these ego defense mechanisms, and it will be a better way to read those defense mechanisms from that link along with the examples that will help you understand each and everything clearly. Then talk about the depression, which is a very like common disorder, and when you talk about psychiatry, the first thing that comes into our mind is the depression, the depressive illness, the major depression. So it's very important for you to know, like when we call a particular disorder as depression, what will be the duration to call it as depression, and what will be the symptoms the patient will be presenting to you, and how will you differentiate major depression from bipolar disorder or depression from adjustment disorder. So it's very important for you to differentiate these psychiatric disorders because the main thing in psychiatry is that the main points that you should focus on is, one is the duration of the illness, because in every disorder there is one particular duration that will differentiate one disorder from another. Let's take an example of depression. Like if the person is presenting with low mood, with sadness, with hopelessness, with loss of interest in activities for around 2 weeks, then is the time we call it depression. Otherwise we cannot label it as depression. So this 2 weeks plays a major role in diagnosing a particular disorder like depression. Similarly, for let's take an example of its schizophrenia. So schizophrenia is a psychotic disorder that we only label if the patient is presenting with positive or negative symptoms for at least 6 months. So these durations are very important in psychiatry, so you need to learn these durations according to the disorder that you are studying. Then comes the bipolar disorders like bipolar 1, bipolar 2 disorder. How would you differentiate these two disorders? What will be the management of these disorders? And like for example, bipolar 1 consists of depression and mania, and bipolar 2 consists of depression and hypomania. So again, what's the difference between mania and hypomania? How will you differentiate these two, and what will be the time duration when you will call it mania or hypomania? So these things are very important. You have to be mindful when you go through these disorders. Then comes the personality disorders. Personality disorders are super important for AMC MCQ exam. And when I was solving the Q banks, the Amidex, the UWorld, I came across many questions related to personality disorders, specifically the borderline personality disorder and the narcissistic disorder, the histrionic personality disorder. So these are disorders that are super important for AMC MCQ exam, and you should know their management as well. Like for example, there is a particular behavioral therapy that we use for borderline disorder, and that is the dialectical therapy. So these some few points that are very important for this AMC MCQ exam. Then comes the childhood disorders. Childhood disorders include like autism. Autism again is a very important for AMC MCQ exam. The ADHD, the Asperger's syndrome. So there were many scenarios, like very confusing scenarios related to autism, related to Asperger's syndrome, and you have to learn the differentiating points between these two disorders, because AMC complicates the scenarios, and sometimes what you have to choose is the autistic spectrum disorder, autism spectrum disorder, or ASD. So like ASD consists of many scenarios that come under this heading. So it's very important to have a good concept on these psychiatry topics. Then you will find it very easy to solve the scenarios. Other important topics include the substance abuse disorder. Substance abuse disorders are well explained in the Kaplan Step to CK. You can read these topics from that book, and it contains a chart basically that you will find it easy to learn and memorize. Then comes the psychopharmacology. Psychopharmacology plays a very important role in psychiatry, because we must know what management, what drugs are we giving for this particular disorder, what is the indication, what is the side effect of this drug, and what is the contraindication of this drug, and if we give the combination of these two drugs, what syndromes they can lead to. Like for example, the SSRIs can lead to serotonin syndrome. So how what are the symptoms of serotonin syndrome, how can we diagnose this syndrome, and what will be the management of this syndrome, and how would we differentiate it from neuroleptic malignant syndrome. So these are very important things that you cannot ignore while preparing this subject. Other important topics and like favorite topics for AMC is the eating disorder. Eating disorder include, like for example, anorexia nervosa, bulimia nervosa, binge eating disorders, and AMC like gives too many scenarios or questions related to these eating disorders as well. So you need to know each and everything related to this. There is a good guideline for eating disorders. I'll share the guideline in the description for this purpose as well. Along with this, you can read it from the Kaplan Step to CK. They are very well explained in that. And what will be the therapies for like management for these disorders. Like for example, for anorexia nervosa, we gave the family-based therapy. And what will be the symptoms patient will be presenting to us, and how would we differentiate between anorexia nervosa and bulimia nervosa. So these are few specific points that you need to focus on. Other important disorders include the psychotic disorders. As I mentioned, just like schizophrenia, we must need to know the duration. We must need to know the symptoms that will be that the patient will be presenting to us, and again the symptoms, that what is the criteria that we can diagnose this as schizophrenia, like what will be the positive symptoms, what will be the negative symptoms, and again what will be the management of schizophrenia, and how will you differentiate this psychotic disorder from other psychotic disorders like brief psychotic disorder, like schizophreniform, like schizotypal personality disorders. So these are different topics that are quite, or like more or less related to schizophrenia, but there are some minor differences that you need to know in order to differentiate these topics, because AMC sometimes give lengthy scenarios, and it like you get very little time to read the question thoroughly in a very, like you have to read it in a short time. So it's better to have a good concept, to have a grip on these questions, on the scenarios, so that you do not take much time to diagnose or to interpret what the question is about to ask, or what the question is asking. So I think that is it for the psychiatry. I'll attach a list of important topics so that you will get an idea what topics you should focus more in psychiatry, so that you do not miss the important ones. Okay, so thank you for now. Bye bye, take care.